Uh, Today, I will be just discussing some common tricks and ways to learn and prepare for any exam, as well as to be a good anesthetist. There is a number of time people ask me this question. I am appearing in as this specific exam. I am appearing in intermediate module, or I am appearing in MCPS. I'm appearing in XYZ any exam. Okay. So what is how should I prepare and what book I should read? Actually, this the answer to this question puzzles me a lot, and there will be certain things which I will be just trying to highlight to you, which will make you understand that post graduation is not like undergraduation. In undergraduation, when we are studying a specific subject, usually our domain is just restricted to that subject. When we were in medical college, we used to study anatomy, and our life was anatomy, anatomy, and anatomy. And they were in good medical schools where there is integrative medicine. They just try to correlate physiology and anatomy and some clinical aspect, but unfortunately it's not there in every medical college, or every part of the world does not cater that thing. So if you are studying anatomy, your whosoever teacher is there, he is just trying to make you not a doctor. He is just trying to make you anatomy specialist. Okay. So similarly, we just grow in our age, and then finally we become a doctor, and then we enter in a post graduation. If anyone happens to be in any other specialty other than anesthesia, I think the domain will be, yes, there will be some integration for other specialties, but I think there are two specialties in medical science. One is anesthesia, and other is family medicine, which needs a maximum knowledge, diversity. And in the recent past, when this anesthesia is integrated with radiological equipment like ultrasound, and the use of this image intensifier for procedures related to pain, or even anything. So actually, when you are if you ask me, not because I am an anesthetist, I think there is no field in medical science which needs more intense knowledge, more intense diversity. I would say that maybe we are not equipped with learning the syndromes, but we know the business end. Okay. So because whatever syndrome a medical specialist diagnose in their ward, at the end of the day, the general care is the same. So we are related more to have a general care, and we need to have a concept like, for example, if you are working in obstetric floor, you should be knowing a lot about uh, physiology of a pregnant patient, and all the tricks and terminologies which are being used by obstetrician. You should be knowing it, like the exam that you cannot become a good and obstetric anesthetist till the time you are fully aware of the basic things over there. So that makes us our role very diverse. And another thing, another challenging, is that there is we have to be aware of almost all the specialities. Okay. So this is one thing. That's why, and because our anesthesia specialty is developed in recent maybe few decades, and it was not as developed as surgery, which has more prolonged history. So that's why, and still to date, I don't think so there are books which are good enough to cover all the aspects, so that it becomes a big challenge for us. Okay. So it's a challenge for us in the way that whenever we are uh, trying to learn any specific topic, the very important thing for us is that we should not be try to find out a book which will be covering all the aspects. This is not possible. I can bet on it, that whatever book you people are reading is not giving you a good information, especially with the brain which we have now in 2022. Okay, maybe 100 years ago, the people still, if you will find your father, your mother, maybe understanding a map, understanding the address of his or her friend by just by the landmarks. But I think majority of people and cannot go back to their home without Google Map. So our brains are in a different tune. Okay, so that makes us a little different, that we should be going try to adjust ourselves with the demands of this century, and we have to slightly modify our way of learning. If we try to just follow maybe a professor, nothing taking nothing away from that person, but unfortunately if you will try to just follow the same path which he followed, it will not be practically possible for you. Okay, because try to open and learn from Miller and Barish, and I can guarantee you will after some time you will be scratching yourself from everywhere. So that is my message for all of you, that just try to learn topic oriented. Okay, and topic oriented, I will be just giving you some hints, that if you are preparing for anesthesia exams, how you can target. So the best thing about is that even if you are in preparing for FRCA or FCAI or MCPS or FCPS, there are certain things which will never change. If you are studying thyroid, everywhere for every exam, thyroid will be releasing thyroid hormone. Okay, it will not be releasing aldosterone. So that makes it is easy for you to start the first step, that everywhere thyroid gland will be secreting thyroid hormone, and in every exam thyroid gland will be in the neck, not in the foot. So that makes it easier for you to just come out of this unfortunate distinguish which people give you, that if you are appearing in FRCA there will be a separate thing, and you will have to stand upside down or jump on the bed to prepare for it. So fortunately there is nothing like that. If you prepare yourself and you make your studies in a way that you are targeting a subject rather without the distinction of whether it is oral or MCQs or written or OSCE or whatever you label it. Okay, so this is the most important thing I will tell you, that please come out of this distinction. Come out of this distinction. If you have the concept, yes, in MCQs you need more meticulous detailed knowledge, because they will be asking you a very tiny detail which will be not be highlighted in oral exam. But similarly in oral exam you have to answer, you have to explain whatever you are whatever word you are using. So that makes it a little bit different, but the knowledge is the same. If you know, if I will give you example of thyroid, that if someone wants to study about thyroid, but from where he or she should start, the first thing will be surface anatomy, where thyroid is present. Then you have to see the levels with reference to maybe spine. Okay, and with reference to the tracheal rings. These are the main two things which will be according to the whenever we want to label the levels, usually we label like that. Okay, so this is one thing. And then the basic anatomy. Okay, anatomy, that what is the arterial supply, what is the venous drainage, what is the, okay, if you can mute the mic please. Okay, so what is the venous drainage, what is the nerve supply, what are different parts, like there is one isthmus, there is two lobes. Okay, so the level of these isthmus and lobe you should be knowing. Okay, then what is the composition of the thyroid gland. Okay, So that what are the components? There are storage of iodine and formation of this protein part, which is making this triiodothyronine, or monoiodothyronine or diiodothyronine. Okay, so these are the components or histological component of thyroid. Okay, then of course there should be some, because that how this secretion is controlled. Okay, so there will be role of pituitary, there will be role of hypothalamus. Okay, and then there is this negative feedback mechanism. And then then you are thinking what hormones are being produced. So there will be T3, there will be T4. Okay, and then when the hormone is there, there is another mechanism for it, is interconversion. Okay, and how much concentration, how much levels of each, and then there is protein binding. Okay, so the free T3 levels will be doing the trick. And the next step will be that what is the mechanism of action of thyroid hormone. Okay, and where they are acting. And they are acting actually in the every cell. So it is just act like the fuel of powerhouse, or controlling the metabolism. So you should be knowing about this whole cycle if you want to understand in a better way. And then there will be a condition in which either it become hyperthyroid or it become hypothyroid. Okay, so you should be knowing the clinical sign, symptoms. Okay, and causes of each hyper or hypothyroid. Okay, so then there will be some treatment. Whenever there is a disease, you should be knowing about there will be some sign, symptoms, there will be some causes, and then there will be some associations. Okay, like for example, if there is some autoimmune disease, maybe you have some myasthenia gravis, or you have some other rheumatoid arthritis, or any other autoimmune disease associated with it. Okay, and then the treatment. Okay, so treatment will be either in the form of for hyperthyroidism or hypothyroidism. The treatment will be according to either which is destroying the gland, or delaying the conversion. Okay, or this is for the hormone, and the other is the uh, stopping the metabolic effects. Okay, so metabolic effects will be usually because of beta blockers. Okay, conversion also but with beta blockers and some steroids. Okay, so this is how you should be targeting. And then you will be looking at, now if you reach up to the level of surgery. Okay, so then you will be looking at what sort of surgery it is, as I discussed before, that what is the urgency of the surgery. This is for any surgery. What is the risk involved? Okay, what are the critical steps? Okay, what are possible complications at each step? Like you will say it perioperative. So preoperative, intra, and post-op. So when you are trying to prepare your topic related to any surgery, I had shown this slide before as well. I can show you before later, inshallah. Urgency, risk, steps, and then what multidisciplinary teams required. Okay, so for instance, if you are doing a thyroid surgery, so you can say that if according to it will be variable. It will not be a single one, but usually there is involvement of airway. Okay, there is involvement of thoracic cavity, like it is going to retrous tunnel. Okay, then uh, and there may be the patient might receive before radiotherapy. So there will be again distortion of this thing, and then some other steps, that this area is with the major vessels, so there may be some bleeding. Okay, then Another important thing related to it is that when they remove thyroid, this parathyroid is also may be removed. Sometime it is identified and then they place it back in the body, but sometime the patient may lose parathyroid, buy one get one free. Okay, so this can happen. And then with reference to especially the recurrent laryngeal nerve, so they are doing nerve monitoring. Okay, nerve monitoring through endotracheal tube. So uh, this is, I'm just guiding you that maybe I'm giving you example of thyroid, but you will find in every surgery, you will find some things, and you should, if you don't find it, you have to search about it, that what are the critical steps, what is the urgency of the surgery, whether it is it has to be done immediately, or it has some time for you, and before that you have to optimize. Okay, because if it is not urgent, then you need optimization, you need referral. Okay, you need some multidisciplinary team, as I told you. So in everything you should be knowing about it. And usually whenever they remove, there will be something before, pre, something intra, and something post. Like in this case, after removing thyroid, one thing I told you about parathyroid. So parathyroid will lead to things related to calcium. So there may be signs of hypothyroidism. So you have to know about the metabolism of calcium, parathyroid hormone. And you should also, if you want to just clarify your concept, you should be knowing what is the role of calcitonin. Okay, and what is the interaction between vitamin D, calcium. So when you are reading this, try to read it in a way that you perfectly cover all the aspects. If you just try to bypass some of the things, like what happens that if you open the Holy Morgan, you will find only few aspects written, and you will just try to cram, and then someone will ask you only one this question: how to anesthetize a patient with large goiter, and you will be in trouble even with this first small question, because to answer this question you should have a thorough concept of how to assess the airway. Okay, so if you just try to read thyroid without very strong grip on the sign, symptoms, tests, okay, and like all the aspects which we do in addition to the physical some distances, okay, like mouth, related to mouth, related to neck. Okay, so the factors which are leading to difficult mask ventilation, difficult laryngoscopy, and difficult intubation. Okay, and there is one thing extra here is extubation, because in prolonged thyroid there is chances of patient having developing this tracheomalacia. Okay, so you have to be ready for it, and you have to evaluate when you are assessing the patient for airway. Even you have to mentally prepare for it, because you don't have to put a pipe, you have to remove it as well. So you have to mentally prepare what will happen post operatively. Okay, so if you just try to bypass the thyroid topic, you will be in trouble in exam. Okay, so another aspect of airway management will be related to awake fiber optic. Okay, because practically it's not being used frequently, but in the exam, if someone is asking you how to anesthetize a patient with a big thyroid, you will always have to use this, because you will never take a chance that you ending up in having a situation of cannot intubate, cannot ventilate, which is a disaster for not only for you, for the patient. So this is like I just come back to what from where I started, that you will not find these aspects written in one book. I can bet about it. But if you don't learn in that way, you will be in trouble, because now you will have MCQs related to thyroid hormone synthesis. There will be control. Okay. And then as the aspects I told you. So if you want to learn any topic, first of all, just try to classify the topic, and then go inside. I will just show you how I because before these having this Zoom meetings, I used to spend more time on making these sort of files, okay, in which I just used to write the questions or the targets or things to do when you are uh, reading a specific topic. Okay. So I think I had written these thyroid questions, and this is how that's what I was trying to tell you. Okay. What is the surface anatomy of thyroid? Level, lobe, isthmus, nerve supply, blood supply, how thyroid hormones are synthesized, how is thyroid hormone synthesis controlled, this thyroid stimulating hormone role of this pituitary, okay, and hypothalamus, and then effect. If you want to have the effects even for hypothyroidism, just try to, rather than reading baselessly, you just try to have that every human being will have a brain, will have lungs, heart, kidneys, liver, a metabolic system, homeostatic system. So rather than reading baselessly, you try to find out changes in every system, whatever disease you are studying. Okay, I repeat, rather than just reading the paragraphs of the book aimlessly, you just try to see what happens in heart in hyperthyroidism, what happens to heart in hypothyroidism. And whenever, for example, to be even more specifically, if you want to see what happens in heart, usually this cardiovascular system, either it is heart or it is vessels. Okay, so if you want to learn what happens in the heart, either it will be in the form of contractility or in the form of rhythm, usually. Okay, and there are some this doors, there is a chamber, and there is a wall. So whatever is happening will be affecting either of the thing. Either the contractility is problem, rhythm, and rate also. Okay, so rate, rhythm, contractility, and there are some door that are the this valves, and the chamber and the wall. The wall become thick or wall become in failure. Okay, so whenever wall become thick, there will be chances of ischemia. So rather than just baselessly reading it, just try to find out in the vessels, there will be it will be related to preload or afterload. Okay, so you just try to find out what happens to preload or afterload in the vessels, or if there is blockage, there is relation to atherosclerosis. So if you just try to have a look at it, if you go to hypothyroidism, you will find that there is more chances of atherosclerosis. When there is more chances of atherosclerosis, the afterload is increased, and there is uh, hypertrophy in the wall. Okay, so this leads to the concept of hypertension related to hypothyroidism in this patient. Okay, so I will suggest you, whenever you are trying to identify, rather than reading, cramming the page, try to find out. You will find for every system things like that. For respiration, there is one thing which is mechanics. Okay, and one thing, there is a smuggling, that is the gas exchange. Okay, and then there is a bridge between cardiovascular system and respiratory system, that is the cardiopulmonary reserve. Okay, like whatever smuggling is being taken, whatever oxygen is being taken, whether it is being utilized or not. Mechanics. So this is the for that you have to correlate cardiac function and the pulmonary function. Okay, so for that thing you have to correlate. And gaseous exchange, O2 and CO2. And mechanics, all these volumes and tidal volume and FRC and expiratory reserve volume or flow volume loops or whatever are things are, this is related to mechanics. So other thing which I'm just using a slang word is smuggling for gas exchange. But actually, if you just think that what happens, maybe there will be not no effect, but maybe there will be some effect. So if you open your eyes and just have a look, I can guarantee you that you are not deaf and dumb and duffer. You can definitely understand this thing, but unfortunately this is not written in that way in your holy books. And unfortunately, majority of us don't have the time to think like that. They will be thinking, what is the pool, what is the exam pool? Sir, can you share the previous questions? Sir, can you please tell which book to read? So I believe me, I have no answer for this question, despite understanding a lot of things. If I'm unable to explain this, this is my sheer failure. So this is the way I will suggest all of you to target studies. Okay, so please, before I go further down, if anyone wants to ask any question or anything, any comment. Yes. Am I audible or I am not audible? Yes, Zunera.
You are audible. I was thinking, okay, I said your like earlier sessions also. Can you hear me?
Yes, yes.
So the thing is like starting all over. Like, of course, we haven't studied like that since long in our past years. There are a lot of difficulty and so on and on. And there are a lot of things that we have. Now we are in the residency program. A lot of from us would be doing job. And how we should plan by, like, I
It's
really want to start like that.
it's
Like,
never
but how should we plan?
it's never too late. Believe me.
Yeah, I totally agree with that.
So so
Like what I am planning is to prepare like in a way that I don't want to care about like what will be the exam pattern be, like either FRCA, FCAI, or EDIC or whatever. I just want to know that much, like I should be confident before going into the examination hall. So how should be the plan be done, like from where to start? And
yes,
okay,
from
I
where
have
to
started
start?
a bit, but
I will just give you again a simple explanation that whenever you are planning to have a party, what you do, you arrange a number of things. So just our anesthesia party, just take a disease, okay, and you will find some of the things related to it. Not only the disease, you will find some complication, or you can say critical incidents. Okay, it will be entangled, like this will be part of that disease. Okay, and there will be some pharmacology related to it. Okay, there will be some physiology related to it, there will be some anatomy related to it. Okay, so actually you are going through all these subjects. Okay, there will be some monitoring related to it. Okay, so that's giving this example of thyroid. You start from, remember one thing at start, the first topic, if you read like that. So I think there are certain topics which you can start in that way, and I can guarantee you that next topic will be easier for you. Okay.
Sir, I totally agree. I have started a few like that since I had first session with you, and it's really very helpful. But the thing is, like, again, while practicing, like in the residency job, there are a lot of other topics that I go to job every day, but I feel myself like I don't know. And what
Yes.
is the basic problem
Yeah.
is, like, I
Ye-
start reading about thyroid, for example, but the
Mhm.
next day I'm going to the hospital and there's some, like in the ICU, something happening, or I don't understand something, like for example antibiotics. It's a very long topic. It's a very, like, it has a lot in it to understand. And then the thing is, like, I stopped reading that topic. I go to antibiotics. I try to cover up that also. I come back home. And then there is another problem, like another case is coming with acute pancreatitis. Like, is it possible, like, you are doing such a great job, like having these sessions and all and everything. Like, now I saw that you have written, like, you will make the WhatsApp group according to the level of the resident they are, like at which level
Actually,
we are. So
actually, I try.
is
I
it
try.
possible?
The, I can understand your question, but I tell you something that there is no like. It's not possible to highlight. I give you an example. I just try to merge two groups. Believe me, I was about to become having double vision after 2-3 hours, because people, I was sending message to them to please leave that group and join the other one, and I was not getting the response. And I had to waste many hours to do this small thing. Okay, I'm just giving you the thing that I'm just trying to do whatever is in my hand. The other thing is that you just try to do whatever is in your hand. Okay, we cannot cross our limitations. I will give you the example of what you were asking, that you just try to make a formula, that you are reading a disease, you are reading some monitoring, you are reading some pharmacology, you are reading some equipment. Okay, like for example, you just try to, and then you take one from homeostatic condition. Homeostasis is for fluid, for acid base, for electrolytes. Okay, so what will happen, that gradually you will be covering these aspects one by one, and then you start with the common cases based study. Okay, so I can guarantee you that if you start it after few months, you won't have that problem. Because for example, if you are dealing with pancreatitis, for example, again you will have a number of things which are common. For instance, just forget about the details. What are the common things which you can face in any other patient? Like first thing I will tell you, pain. The first thing about pancreatitis, you can tackle, even if you have handled any other patient, pain. This is first thing. Other thing, in with reference to ICU, journal ICU care. Okay, journal ICU care, which will be there in any patient. You can apply the same things here. Okay, the basic, uh, I hope you understand my point. If you just try to be pinpoint that, like, you don't try to become a specialist of pancreatitis that day, just try to apply whatever you know, and you will understand that you are getting a number of aspects of pancreatitis known to you. Okay, like for example, risk scorings. Okay, risk scoring, or for prognosis, as well as calculating the mortality morbidity. Okay, so this will be here. So do you agree or not?
Sir, I do agree. But again, the thing, yeah, this is how I can cover maximum, like taking some things as common. But even then, I have to spend some time in order to read pancreatitis, like, okay, not like specialist, but at least to be confident, like to know at least much better than I am right now, like
For
to improve
any
my own
for
self.
Yeah, for any disease, you just start with what are the causes, what are the problems. Okay, and how to diagnose, how to treat. If you just try to simplify yourself and start slowly, you will be maybe in one step, you will be able to understand pancreatitis 50%. Next time it will come, you will just revise it, and then you will be even better. So that's how it should be. Because I tell you that if you try to, for some people tell me, we are given advice, try to read first 13 or 15 or whatever bloody chapters of Morgan to start with. Okay, and without any understanding, just trying to read, and what is that? But just tell me one thing. Okay, this seems weird, the thing, the style which I'm telling you to follow, it's weird. Okay, but what about this style, the other style? There is no other, there
No,
is
sir,
no.
I totally agree. Your style is the best I have ever seen. Like, I have tried also, and this is the best one. Like, you are covering one thing wholly, like fully. You have the idea about it. Like, if everything, like, if anything that happens later, like if I know thyroid by heart, I mean, okay, realistically, I think it will help me more rather than just going by the book and not thinking laterally.
Remember one thing, there is time for everything, and with passage of time, you will be, don't worry, take your time, because you see, when I tell this thing to a person who's appearing in I intermediate module, I'm short of ideas. What should I tell to that person? But the thing is that you have to start someday, and that's why my main target is first year resident, whom I can spend my time, whom I can change. Because the person who is in fourth year residency, he is immune. He will not listen to me. He will not change his way, and he will pass the exam, and then he will be regretting after few years. Because, like, everyone will not have the same scenario. Okay, if you want to challenge yourself, like I learned in last 1 year since I started the Zoom lectures, believe me, I learned a lot. I was not at the same state despite passing all the exams 1 year ago. That's the last year, exactly this time of June, almost maybe early days of June, I had COVID. I sat down in the home, and for the first time I started. So it was a hair which was created in that share of COVID. So I'm just telling you, it's a long way. Okay, you have to, you
So I
see,
have,
if you started your way towards nice thing, forget about anything laterals. Just keep steady. And just like the old story which we started to learn about, this what was a race between tortoise and a rabbit. So same thing will happen, I guarantee you. Okay.
sir, I have one humble request. I don't
Yes.
want to force or stress something, but just one humble request. I was thinking since last few weeks, if you can please, like for the few months, assign a certain topic after every 3 days.
Okay. I have tried many things. I don't get volunteers. Yeah, here there is
Sir,
one
I will be, I will be
yeah.
volunteering.
Yes, I hope and I pray that you remain steady, because there is one person here, Shamail, you are now silent. Okay, there are few people I find, but unfortunately one of them got married and she never came back. One of them became busy in private practice and he ran away. And there are so many. How many people are here at the moment? I've spent at least 20 minutes to send the link on Facebook and on WhatsApp. Okay, so unfortunately the problem is that nobody is having time. I just try to spend my time. I'm then just sharing with you that you have to invest your time, then you will get the result. Believe me, I'm just telling you, because I told you I recently have a baby boy. So I just asked my wife, she took the baby outside. She's sitting in the lounge and I'm sitting in the room to take the class. So you have to make the things happen. So even if, for example, I volunteer, I request, so many times I've requested, please take one topic, take one topic, take one topic, prepare, give me help to prepare these questions like that. I have made here. I am right here. Okay. So the way I showed to you, I can guarantee you, I can challenge you. If you read Thyroid like that, you will not miss any single body question in your exam. This is my challenge to you. Okay. So just
Sir,
I
sir,
can
you
try
can, you, yeah, please.
volunteer any topic. All of you are requested. Whosoever listen to me, send a message. I want to prepare that topic. I will give you the guideline, because unfortunately it's not possible for me to prepare the slides and everything. Unfortunately, even for example, I accept one thing. I was trying to tell you about pharmacology. Then I opened these books, and then I opened this article, and I need to revise about what is the three compartment model. Then I thought that today it's not possible for me to discuss about how to study pharmacology drug. So I just try to focus on the thing which I was able to talk. Okay, but I can guide you. Whosoever wants, just all of you are welcome. I was trying to do, because now this exam is finished, so Actually, I started this OR pollution, the topic which but I because that day I was not comfortable. So I need to I will come back to for that topic. Scavenging, OR pollution, humidity. Okay. Ah, what are the factors which can increase the OR pollution? So we can make a topic. You give me suggestion, whatever topic you want to discuss. I'm welcome to all of you. Okay. So
Sir, I think the way you are teaching that the daily topic wise classes, it's okay, but give us some
hint
topic which,
before.
but we should have some days to prepare it, 4 or 5 days, because it takes time to thoroughly prepare a topic.
No, you are absolutely right. But thing is that for that, I need support from all of you. I cannot do it alone. Even some people here are from different part of world. So I'm telling you that I'm trying to do whatever is possible for me. I just make these lists and everything. Like for example, I tell you, just I will show you something that I just made once upon a time this. I can do it. Like whatever system you want me to start. I was thinking that I will from next few moments, I will in sessions, I will try to have one topic of pharmacology, one monitoring, the way which I am telling you. I will take one disease. I will try to cover the aspects possible. Then one because if you ask me that we should be reading all the monitoring, after some time you will be collapsed. I will tell you in the first setting how to target any monitoring. Okay, I can tell you right now actually. Okay, that whenever you want to, actually I made it for pharmacology. Just a second. Yes. So this is for pharmacology. I can tell you about this one as well. This monitoring equipment. The first thing you should be knowing what is the working principle. Okay. Any monitoring working principle. What are different ways or different types of the monitor you are using? Okay. So what are the interpretation? Okay. What are the troubleshooting if something happens, what you will be doing? Okay. And then what are the limitations? So if you are reading any monitoring or any equipment, if you just try to learn in that way, you will be able to cover it. Okay. So and this is related to, I was just trying to, I couldn't complete it because I remained in between, that whatever drug you are reading, you have to know what is the group of the drug. Okay. What group of drug it belongs, what chemical nature of the medication it is, and then you will be going forward, that what is the mechanism of action, what are the systems involved, what is effect on CVS, CNS, respiration, metabolism, renal, because there will be one thing which is related to what the body does with the drug and what the drug what does with the body. So these will be the two things you should be looking at, and then you will be making the main points. And then last thing, this is very important, drug interactions, because any drug which is having interaction with liver or kidneys or any other drugs will create a problem for you being an anesthetist. Okay. So like I hope the message which I wanted to give you by this discussion, I just try to do it in coming days. If any one of you want to have a specific topic, just send me a message. Anyone who wants to volunteer to prepare a topic, I'm there to help you out. Okay.
So can I say something, please? If
Yes,
you,
yes, please,
I'm
please.
not interrupting. So I would like to suggest, if everybody is in accordance with that, like we should fix 2 days, maybe Sunday, because we would be getting Friday and Saturday to prepare, and one Thursday, like we would be getting the whole week to prepare, and to assign us topics, or maybe I can also volunteer like the topics.
The
And the
problem,
thing is, like, we
I'm
will
sorry,
prepare.
with the problem with the day will be that I have off on Friday and Saturday. Okay.
No, I am saying Sunday.
Okay. No problem.
Or it's not a problem for me, any day would do for me. But the thing is, like, sir, you shouldn't explain, or you should start by asking us the questions. Like, if I am preparing for example, thyroid, you should start asking me questions, because I am supposed to answer according to what I have studied. This way, you will also understand, like, if I am doing it better or not. And in this way, you don't need to explain, because I
Oh,
have already read it, and you will
perfect.
just fill on the,
Yes, I will just
yeah,
comment
fill
you
on
on
the
this.
gaps.
Comment on this thing, that actually I always try this thing, but if I don't get the response, only then I add on. Okay, so if you are prepared, of course I don't need to interrupt you. Am I right?
But mostly we are not prepared. This is the thing, like, we are blank and we
Yes,
don't know.
you are right.
But
You are
if
right.
we are being assigned a topic, it's our responsibility to prepare it beforehand, and then we
Yes.
are supposed to answer. I think this should be like the oral exam.
Actually, fortunately, you are not in Pakistan, so your response is a little bit different. People in Pakistan today, they will be discussing about what's going to happen after 1 month, after the super taxes being imposed. So, unfortunately, their priority is totally different. They are not people in Pakistan. They are doing two jobs. Okay, for example. So how will they focus on these things? Unfortunate. This is, I again say
Sir,
this.
I am also doing a job without any pay, and I'm in the 4th year, and I'm doing since last 4 years without
anyways,
any pay.
anyways,
And I
I
also
think,
have a family. I
I,
have,
I think, I think
yeah,
whosoever is here, before I finish, if anyone of you please want to speak out something, because sometime I become very disappointed by the response I get. I send the questions, and you know what answer? What is the next question which I get? Sir, have you written the answers of these questions? And then I don't find any place to hit my head. I'm writing all this. I'm not copying copy paste. I have told you the pearls, that these are the things you should be knowing if you want to answer the questions. And then they will be, sir, we are preparing for MCQs. So, sir, this is, we will do inshallah when we pass the written. When we pass MCQs exam, then we
but
will come
how
back.
come, sir? In,
Yeah.
like, I have seen in UK, in Ireland, a lot of Pakistani doctors who are better than the Europeans, but we have the cream. I don't know how they study, but the thing is, like,
Zunaira, the problem is that
I have
recently
seen very good doctors from Pakistan.
in last few years, they have changed the pattern a little bit. I have a strong reservation because I have passed the exam before this change. The people who are studying these days, they are unfortunately exposed to a very, very bad setup now. I'm really sorry, because then I get the messages from my seniors that don't you criticize, but actually reality is that they have changed the pattern. They have made it MCQs based total, so it becomes a problem. Okay. So anyways, I take your advice and I will try to make it more predictable, and I will try to give the topic before. Okay, there may be some changes in between, so what I will try to do, that I will fix few days in the that next week in which my routine is predictable, so I can give the topic to anyone, any volunteers. And then the rest of the days, if I'm not able to have time or anything, we can discuss something like. Okay, so that's what we will do. So thanks a lot, all of you, for your presence. And again, all the recordings are available on YouTube. I am not using YouTube to earn. This is not my and intention at all. Okay, I have no financial interest, but I want respect and response from you people. If you people don't respond to me, it's my insult. That's what I tell you. That even, for example, if you just imagine that if I am giving 1 hour of my personal life, when my newborn with whom I can play is outside with my wife having anger on her face a little bit, though she knows she's immune now. But if you don't respond to me, that's disappointing thing for me. Okay, so thanks a lot, all of you. All of you are welcome to ask any question anytime. I am available all the time. Whenever I see the mobile, I respond. Okay, so thank you very much, and bye bye.